So Dr. Sunil GS, Senior Cardiac Surgeon, Pediatric Cardiology Surgery, Lissie Hospital, Ernakulam, is our mentor and guardian. A life dedicated to the service of the CHDs. That is what would describe him perfectly. May I call upon Dr. Sunil for the presidential address.
So as I'm beginning my talk, as the title suggests, it is the discussion about congenital heart disease, these issues, concerns, and solution. As already mentioned by Dr. Harikrishnan, this is based on Dr. Anita Saksena's paper published in 2018. There are estimated 2 lakh births in India per year. I mean, around 2 lakhs children are born with heart disease in India. Considering about 0.8 to 1% incidence of heart disease per 1,000 population. Of these, about 10 to 20,000 may need intervention per year in India. I mean, what I mentioned was around 20 to 40,000 need surgery or intervention. Only the facility to do only half these patients at the moment. So what happens to the untreated patients? So some of these children with correctable lesions in the appropriate age that can lead to normal life, they were not operated, and after some time they become inoperable, and they have to lead a lesser quality of life the rest of their life. But there are other complex heart surgeries. Without surgery, they won't live beyond 1 year. But there has been tremendous improvement in the surgical outcome in the last 2 to 3 decades. Since more and more children are having surgeries and they are becoming adults, there are more adults in the population than children with heart disease. So if you group these adults with heart disease, they can be included in 3 groups. Group 1, this actually comprises about 50 to 60% of the population. They are actually simple correctable lesions who had a completed treatment in the appropriate age, like AST, VST, PDA. As I mentioned, they constitute the largest number. They have more or less normal lifespan. They don't really need a serious recognition as patients with the treated CHD. But in the group 2, these are the people with the 2 functioning ventricles. So they can have corrective surgery, but the only problem is that they need re-interventions. Some of them had valve repairs or replacement or conduit placements. They have to reoperate it as and when needed. Managing them at the proper time is important. Otherwise, they develop this damage to the heart, and delayed intervention will not produce appropriate results. So key here is that correct follow-up and appropriate intervention. In that case, they can lead a more or less a normal lifespan. They will have a more normal lifespan. So coming to the group 3, these are the people having complex heart disease. So mostly the single ventricle patients come in this category. As I tell these relatives, if one chamber is not there, you cannot create another chamber. So what we can do is do some adjustments in the circulation so that they can lead a more or less normal life. So they may or may not require further surgery, but some of them eventually end up in heart or heart-lung transplantation. So all these patients, all the patients who had single ventricle or who are having a ventricular dysfunction will come in this category. So coming to the natural history of treated and untreated heart diseases, there are conditions, as I mentioned, once they operate, they have a normal lifespan and they are like normal population. And there are conditions with the only marginal benefit of surgery actually, because if you operate, they will have marginal benefit. And of these people also, you need a constant follow-up and correct intervention. Otherwise, it is better leave them alone in the first place and do a medical management. But as the experience with managing some of these conditions is evolving, and some surgeons are attempting these procedures. So for example, to say a condition called pulmonary atresia, and when there is no pulmonary flow that is coming from the heart to the lungs. And this pulmonary flow is made up of small vessels coming from the aorta. So you defocalize them and complete repair. Some of them constantly require a follow-up and they need a intervention. Otherwise, they will become worse. For them, for these patients, leaving them alone will be better than treating. So what is the extent of the problem in India? In India, how many adults are there with the heart disease, treated or untreated? Exact number is not known. An article published in Circulation in 2010 says in United States there are 2.4 million people with heart disease living in United States. Of these, only 1 million are below 18 years and 1.4 million above 18 years. So that means more adults are there than children with heart disease. Of these, about 3 lakh people are estimated to be having severe heart disease. So comparing the population of United States and India, there can be up to 1 crore Indians maybe having treated or untreated heart disease. So this, as I mentioned earlier, this group 2 and group 3 patients with complex heart disease, they are the people you have to focus on, like adult congenital heart disease. So this prevalence of adult CHD is increasing. Now, like the previous study, there are more people with the CHD beyond 18 years there than under 18 years. So they have been managed in special clinics and various terminologies are used to describe them, like a grown-up congenital heart disease, or adult with congenital heart disease, ACCH. So whatever is the terminology, young people and adults with CHD need a lifelong expert medical care, especially for those patients with residual lesions and who are only palliated. If we come to the actual problem with living with heart disease, they will have this varying degree of effort intolerance. These children in the schools, they will realize that they may not be able to walk fast like their colleagues or classmates, and their exercise tolerance is limited. And they should have that understanding and about their limitations, and then they can lead a reasonably better quality of life. Otherwise, they will be frustrated. And some of these patients can develop rhythm disturbances. So suddenly, this rhythm disturbances occurs. A previously asymptomatic person can become suddenly symptomatic. They need interventions like electrophysiological studies and many things. And of course, they can develop heart block and the need for a pacemaker. That once a pacemaker is in, pacemaker change and interrogation is needed. And these people can develop valve leaks, ventricular dysfunction. And as I mentioned earlier, unless there is some kind of a lifestyle adaptation is there, they do the high physical activities, these valve leak and ventricular dysfunction is going to increase. And of course, there are various complications following Fontaine operation. Their cardiac output cannot go beyond certain level and their exercise tolerance is very low. And of course, the need for intervention is there. And this adult with congenital heart diseases, they have non-cardiac issues like infection, like COVID. And many of these patients who had undergone surgery developed COVID and they require more attention and treatment. And these people can develop acquired heart diseases like coronary artery disease. And all these things require multidisciplinary management. And coming to the social issues, actually growing up with congenital heart disease is something only the feeling can be shared by the parents or the patients itself. How when they become aware of the heart disease for the first time, maybe by seeing that scar, visible surgical scar, and these children will ask why I am having this scar here. And when they are frequently, they have to go to the hospitals and they have to take leave from the school, and they were worried actually. So at that time, we will have to counsel them in stages so that they won't get frustrated. Actually, all these counseling and all are important. And regarding the education of these persons with heart disease, the 20% of the patients may be having attention deficit disorder and neurological problem, but majority, 80% have got normal intelligence. In fact, some of these patients having a normal sibling, the parents will tell that there is no difference. This boy will study better than the other boy. So the intelligence wise, there may not be much problem. Only the physical activity may be restricted to certain level. And the question whether they need such people, whether they need special schools, probably no need, because they probably won't be able to participate in this competitive sports, and the physical activity, they have to do less activity. I mean, that will help in the long run. There is no studies associated to prove this, but logically thinking, a person with having a ventricular dysfunction or a valve leak, it's tend to increase with the physical activity. And teachers and the school authorities should be aware of this, their children's problem. And some of them, the school, it will be in the second story or third story. So these children has to climb stairs. And some of the schools will have very heavy school bag and all. All these things are small problem associated with the congenital heart disease, and these relatives will come and tell us. And regarding the rehabilitation of these people, employment, finding a suitable job is very important. As I mentioned earlier, 80% of them will have normal intelligence, and most of them have got normal intelligence. They study well. They may not be able to do very strenuous activity. It also depends on this condition, their underlying pathology. But by and large, they may not be able to do a physical activity like a normal person, a person with a normal heart. And but nowadays, this IT field and all are coming up, so they can find employment in IT fields and many areas where there is not much strenuous activity. So they have to, at the end of the day, they have to acquire ability to stand on their own. And the social system in India, unfortunately, it is like a family-oriented. When the parents become old, children are supposed to look after them. Actually, unfortunate aspect here is that when the parents become old, the children also, these persons with heart disease also will become reach the end of their natural history. So a strong social support is needed in such situation. A person with heart disease having a normal siblings without any problem is a good solution in this. But some of these parents have opted, when they have heart disease patient, they don't opt for other children because their focus, they wanted to be into this only child. So that is also a important factor. And regarding rehabilitation, coming to marriage, most of the patients can undergo marriage. Problem in India is majority of the marriages are arranged marriages only. Majority, maybe 95% or more than that. So finding a partner may be difficult because there is social stigma associated with the heart disease. So finding a partner may be very difficult. This is something very important factor. And some regarding problems with the pregnancy and childbirth, some patients cannot conceive actually. This has to be counseled before marriage. Some people can take, or you can tell them you have to take risk, like there can be IUGR or abortion and all these things. And there has to be adequate counseling during pregnancy and childbirth. Of course, a spontaneous person, patient coming for delivery should be in a very in an institution where you have expertise in managing CHD. And one thing about disability, there is a government of India issues a disability certificate actually that will help in the finding jobs, and there will be scholarships, and even for writing exam you will get more time, and various conditions are included in the 2016 act. In fact, they have added many things from the previous act. Congenital heart disease doesn't come into this picture at all. It is something we can seriously discuss and take necessary steps so that this CHD can be included in the this Disability Act, and they can have this disability card, and with this card they can have some financial concessions, job reservations, many things are possible. And financial problem, actually that is important problem. Only a small percentage of the patients can have that ability to finance their the treatment. Majority of them depends on other sources. There are various government schemes available. Kerala has got efficient Hridayam scheme. They have incorporated some all the private hospitals who do congenital heart surgery also, and provide free treatment for up to 18 years, irrespective of their financial status. That free treatment is given. It is efficiently run scheme. But beyond 18 years, there is no such scheme available, or maybe it's not viable schemes available. So insurance, regarding insurance, some of the foreign companies or some of the people works in high IT firms, they have insurance that will cover the congenital heart disease also. But the general insurance that is available to the public, they don't cover the congenital heart disease. This is some area we have to look into seriously and take the necessary steps. And what is the future holding for us? So we will have to have enough personnel to manage the ongoing problem. So in the future, there will be large number of treated people with the congenital heart disease who requires admission. There can be admission every day with some problem. So there has to be enough hospital beds and necessary infrastructure. Human resources is important. We should have enough surgeons, cardiologists, anesthetists, nurses, and associated paramedical staff to manage this. And similarly, as I mentioned, these people having other diseases, they also to be treated in a very center where you have the expertise available. So what our goals, what we can suggest to the government is that one is that we don't know the extent of the problem. We just derive these numbers from other sources and ask them to create a national database for persons with the CHD, or CHD can be included in the next census. And as I mentioned earlier, disability, CHD can be included in the disability, and of course with the disability card, you can have this reservation in jobs and some financial support. And there has to be facility to provide guidance in pregnancy and childbirth. And financial supports, government schemes should come, and inclusion in insurance. To conclude, there has been increase in adult CHD. It is going to increase only because of this improvement in surgical techniques and outcome. And disease heterogeneity also improving. Previously, the conditions we don't operate. Nowadays, we are operating. So they are also coming into the picture. And surgical work or interventions will get more complicated. So you do catheterization, a person who had undergone several catheterization previously, the getting access and all will be difficult. So need more people with the expertise. And the resources is important, and need to have more people in our field. Another thing, educating some of the patients, they can give guidance to a particular group of patients, and it is important to have public awareness, media coverage, and to achieve some of our goals. I think I will conclude my session here. Thank you very much.